Well, I'm Tim, and I am a podiatrist. I suppose I'm a sports podiatrist, but I'm only really interested in running. I'm not really interested in anything else. I'm a runner myself, so I'm naturally gravitated towards my tribe. Inevitably, that means a lot of running-related injuries, musculoskeletal injuries come into my practice. It's a very much, I think it is a bit of a niche bit of kit in terms of its application. I would say for me, it has a fairly narrow application. I use the shockwave for two things: chronic Achilles tendinopathies and chronic plantar fasciopathies. Those are the two. Unfortunately, I get a fair few of those, so I get a fair bit of value out of it. When I just had the shockwave and people were coming in with perhaps more of a neural plantar fascia type problem, I found that the shockwave is just too much for them. So what was lacking in my practice, and I had the therapeutic ultrasound, which is not very good, and I had my my hands-on MSK sort of rehab skills, but I didn't really have anything that could relieve the more acute inflammatory type of painful issues that, again, a lot of runners and other active people come in with. It's a good sort of year or more of looking at it and thinking about it and listening to stories and jumping on the webinars and the increasingly positive feedback that was coming through. And so it seemed to me to be the missing piece of the puzzle in my practice. So kind of fast forward. I mean, I would say that immediately on using it, I started to get good results. And I'll be struggling to pick out any particular sort of case, but again, people coming with those fresher injuries, and what's impressive about it, actually similar to the shockwave. I mean, the shockwave, although it's uncomfortable, people usually get up and they feel better after a session of shockwave. And with the laser, it's the sort of instant feedback that you get, and it just fills a nice hole in that it's a nice bit of first aid that I can offer to patients who have more sort of perhaps more acute injuries. The way it works really well for me is you get the pain down so that the patients can do their exercises. And for an MSK practice, particularly for a sports practice, getting people doing rehabilitation exercises, strength and conditioning, to get them back to full strength is really important. And what stops people from doing that, what stops people from progressing, is it's too painful. So if you can get the pain down, they can do more exercises. You can start to introduce slow, heavy loading at an earlier stage, and you can sort of build up that healthy collagen, in the tendon or what have you, and you can get them back to activity. So that for me, it's not the whole thing. It's not the whole rehab program, but it enables me to progress that rehabilitation program that much more quickly. It's a clinical decision, but it's a bit of I suppose there's an element of psychology to it as well, isn't there? I mean, laser will work for everybody, because it's not distressing at all. You won't feel any pain while it's being done. So you can't go too far wrong with it. If you put shockwave on somebody who's got a reactive tendon or something, I can let you know in no uncertain terms they don't like it. It's not going to be pleasant. I think I had one patient where I wasn't, it's sort of a bit borderline. I thought, well, it could be the laser and it could be the shockwave, or maybe a bit of both. So what I sort of said to them is, well, we'll travel along this road and we can switch to the other if we need to. And the one thing I will say, which I think is probably key in all of this, is that since I've had the laser, I've used it almost every single day. I don't use the shockwave every single day. The shockwave is something that people specifically book into, and it's I'll use it once or twice a month.
Interesting.
It's plenty, to make my money back on it and get a good result.
It works when you
But
need
the laser literally every day. It's just got that wider application for a lot of different pathologies, I feel. And I've just got growing numbers of I mean, check my GMB page. I've got growing testimonials when people have had the laser.